All right, so I wanted to kind of just start out with a little bit of statistics. It says here that 1 in 5 US children are diagnosed with a mental disorder, whether it's depression, anxiety, behavior or conduct, or any type of developmental disorder. 1 in 10 children are affected by serious emotional disturbance, and we typically identify this as, disruptions in daily functioning, whether it's at, home, school, or in the community. Those are like our 3 main areas that we try to scope into. Then it says here 70% of children entering treatment does have a history of trauma. So a little bit about PCRC. So our mission is saving lives by passionately caring for children, families, and the community. So who we are. So we have staff that consist of LCSWs, LPC, psychologists. We have early childhood consultants, psychiatrists, APRNs, care coordinators. We provide different level of services ranging from more intensive outpatient program for kids who are struggling in those 3 areas that I spoke about earlier. We also provide outpatient services, so that's your typical individual and or family counseling. We also have or Child First program that goes into the home and actually work on that attachment between the parent and the child dyadically. So who we serve? So we serve families and children in the towns of Ansonia, Derby, Oxford, Seymour, Shelton. We do not have a catchment area currently. So if a family decides that they in Stamford wants to be serviced at PCRC, they're more than willing to be we're more than willing to provide services to them. Our age range goes from birth up to 18 years of age. We primarily focus on children and families with any type of emotional, behavioral, psychiatric, and learning difficulties. So mental health facts. So as you probably will see a lot through the presentation, there are a lot of different statistics here on my slide. So it says here 20% of kids ages 13 to 18 live with some form of mental health condition. 50% of all mental health conditions begin at age 14 and 75% by age 24. 1 in 4 parents find it difficult to get their child's mental health services. And then the last fact, the average delay between onset of symptoms and intervention is anywhere between 8 to 10 years. So essentially it's going to take, this is saying that when a parent or guardian, notices that something is wrong, it's going to take anywhere between 8 to 10 years for them to seek the services, or for them to receive the services, I should say rather. All right, definition of mental health in childhood. So the Center for Disease Control, CDC, defines this as children being able to reach developmental and emotional milestones while learning healthy social skills and how to cope when there are problems. So, when we think about the developmental milestones, we think about this different ages and stages of development. So say, for instance, when we're talking about anywhere between ages 1 to 3, kids are typically biting in this age, and this is where we start to think about potty training. So if we now go to age 7 and we have kids struggling with biting, then that's where we kind of see that there might be that developmental milestone may not have been met, and we're trying to see some problems here if they're 7 and still biting. Then there also, when you go into ages, 6, around kindergarten, 1st grade, this is where kids typically start to make friends. So they're kind of more social, their kind of goal is to kind of really start making friends and doing things with other peer group at that stage. Mentally healthy children have a positive quality of life, and they can function well at home, in school, and in their communities. I think I went too far. All right, when to seek help for a child. So all children will experience periods of anger, frustration, and sadness. However, for some children, these normal stresses can be overwhelming to the point that it interferes with their everyday life. So such as, if they're having difficulty at home, in school, interpersonally, or within the family. If they're having difficulties, if these difficulties are affecting his or her ability to eat or sleep. If they're having a hard time in situations where they used to be okay. If they're experiencing problems significant enough that they're causing the child or family members distress. And families often wonder and ask the question, if what their child is experiencing is kind of typical, and how to separate what is normal from what is not. So we kind of talk about considering these few things. How long has the behavior or emotion been going on? Are we talking about days, weeks, or even months? How frequently does the behavior or emotion occur? Are we talking about several times a day, once a week? How intense is the behavior? So annoying, upset, or is it very disruptive? Again, disrupting those three main areas that we talk about. Has there been a traumatic event in the child's life, such as a death, accident, illness, or changes within the family? Because those environmental factors will impact a child's level of function. So where, that kind of changes, it changes everything. Are we dealing with the child responding to a traumatic incident, or are we talking about something more prolonged? So what are some warning signs? So for younger children, this may be intense anxiety with separation from caregivers, or it may be a marked decline in school performance, poor grades, some of severe worry, fear or anxiety, hyperactivity, persistent nightmares, persistent aggression. For the younger children, I like to, when I'm talking with my parents, the younger children tend to have what we call like the externalizing behaviors. So a lot of times when we have that underlying issue going on, the younger kids may just really present with a lot of frustration, kicking, hitting, yelling, screaming, biting. And this is kind of maybe a sudden onset or maybe a prolonged delayed onset, but that's typically what we see in the younger children, those externalizing behaviors. In preteens or teenagers, we see where there might be a marked fall in school performance, inability to cope with problems in daily activities, frequent physical complaints, sexual acting out, depression shown by sustained, prolonged negative mood and attitude, difficulty sleeping, thoughts of death. We may have some abuse of alcohol or drugs, intense fear of becoming obese. We might see some self-injurious behavior, self-destructing behavior. So for my teenagers, sometimes they do present with a lot of internalizing behavior. So they're kind of really bottling everything up and they're holding it tight inside, and they're not really showing the externalizing behaviors as we will see with the younger kids. So if we have teenagers who, are typically social and, they're every day going out, doing all these things, and then suddenly we start seeing an increase in isolating behaviors. They're not really sharing much. They're not really talking much. They're not doing their schoolwork. They might be sleeping a lot. These are things that we kind of look out for to see maybe there's something going on. How to nurture a child's mental health. So this really talks about, just be patient, actively listen before offering your advice, model healthy behavior, share your feelings and validate their feelings, use open-ended questions, limit electronic time for everyone. Routines and schedules are really important as we really try to develop a child's mental health. Set and respect boundaries, be present, be in the moment right now. So these are some of the ways that we can nurture a child's mental health. So how do we support children and families during COVID-19? So, this is a very stressful time for a lot of our children and families. There's been a tremendous amount of change that has occurred in their everyday life, from school, from home, from routines that they would do 7 days a week, 5 days a week. So right now we kind of talk with families about, managing their expectations. So the same expectations we had 7 months ago prior to COVID-19 won't be the same expectations that we should have now, because things have changed. So we have to kind of be present and change all the expectations that we may have. We have to be mindful and in the moment. As I mentioned before, structure and routines are going to be especially important as we go through this change. There might be some difficulty in the beginning. However, let's maintain the structure, routine, meal times, bedtimes, their time. A lot of my parents right now, they're actually, they're taking on tremendous tasks because they're now parents, they're now teachers. Some of them may have to be doctors. I mean, they're playing multiple roles in the moment. So practice self-care, take time for yourself, you know, do a lot of deep breathing. Caitlin kind of mentioned an exercise earlier, which I think is a tremendous exercise, and I might start utilizing that with some of my families, like learning how to be grounded and centered, self-care, and remembering, you know, we are all good enough. You know, I've heard this a few times where it says, you know, new research finds that like caregivers only need to get it right like 50% of the time when responding to their child's needs for attachment to have some type of positive impact. So, you know, I try to keep my families, I try to help them to remember that, like, you know, that we're good enough. This is all a very stressful time. Let's kind of just self-care, work in the moment, and kind of be there for ourselves and our kids. Thank you. Any questions?